may we know the position of the DepEd and the Department of Health on the position of the Philippine Medical Association as presented just right now, that it may not be necessary to close down schools?
Sir, nung time na ang mode natin, sir, is on containment, where we only had like 1 or 2 cases in a school. It's totally different from the suggestion of our reaction here that we don't need to close the school. Based on the experience of the different countries wherein they would close the school just to slow down the spread, we would agree with the way the other countries would do the same thing. With what happened to LaSalle when it was the first school where we had our initial case of the H1N1. When we closed LaSalle, we're glad to say that we didn't have any cases now that has been transmitted within the school coming from our index case. We're not saying na LaSalle hindi na po makakaroon, but it may be coming from another index case na pwede pumasok po sa LaSalle. So, school, as a group, we had talked with the WHO, will serve as an amplifier for this H1N1. I disagree as well when Dr. Liachon said that you need like distance and everything. We all know how kids do when they have recess, when they have before their classes would start, they would congregate and play, and when they play, they do not like hindi mas sila nagbubulungan lang.
What is the answer?
We do not agree, sir.
You don't agree? How about them then?
Sir, we always follow whatever the Department of Health advocates, because we always depend or memorandum is always following whatever the Department of Health recommends.
So in other words, whenever there's an incident, there's a case of H1N1 in the school should be closed.
Yun ang stand natin as of now, sir. As you said,
for how long?
We regularly review our
For how long should the school be closed?
Mag-iiba lang yan, sir. For how long? 10 days ang recommendation namin.
10 days, so
yes.
10 days parati. Now, pag nagdalawa, let's say, how many schools are there in the country? Is it possible that we will have a lot of schools closed by July?
Sir, 43,000 public schools, sir. 43,000 schools are all over the country.
That's including the small elementary barangay schools.
Yes, sir.
But your thesis is that, I think, DOH, no? Or was it you? That the more vulnerable are the private schools.
Sir, the vulnerable, sir.
For some reason, jet-setting exclusive schools are the more vulnerable.
Yes, sir.
Because it is they who travel,
yes, sir,
pick up the virus.
Based, sir, on the DOH data po, Mr. Chairman, nakuha po yung data niya from the DOH po. The jet-setting
But kasi noong time na yun, people were coming back from vacations.
Yes, sir.
Pero ngayon, may pasok na. Does that mean that maybe the schools are more impervious now to contamination?
Maybe you from DOH, please.
Initially, yes. Yung mga jet setting na sinasabi ni Dr. Liachon po.
You agree with that observation?
Initially, ganun po. Kasi they will be coming na from vacation.
I mean, do you agree with that observation? That the private schools are more vulnerable based on this?
Initially, but not now.
Not now?
Not now, sir. Kasi like H1N.
Oh, by the way, saan galing yung sa H1N?
Ang H1N po, sir, ang link natin is, although we're still in-investigate namin po yun, is prior to this, nagkaroon po ng mga reported cases ng H1N1 sa Barangay Hilera. Meron pong isang activity na kinonduct po doon, nagkaroon po isang medical mission po. So yung nag-conduct po ng medical mission will be coming from schools or ano na may reported case po.
So the doctors were the one who delivered the virus.
Mr. Chairman, I have just one question. What if, sir, let's say, in the one school, sir, you have recurrence, sir, of infection, sir, and then, let's say, in the public school, whatever school, sir, Ang ibig ko bang sabihin po nun, magko-close po tayo ng school po lagi po. Ilan po gusto ko pong tanungin kasi tinatanong ko ng asawa ko po yan, tinatanong ko ng mga bata po yan. Para klaro po sa ating lahat na paglabas po natin dito, may sasabihin po tayong definitely po para sa mga tao po.
Dr. Isoy.
Yes, sir. If you're going to review our guidance, kasama po doon yung naka-indicate po doon na pag nagkaroon po ulit ng H1N1 sa the same school, say after a month, say Lasal after a month nag-report ulit ng H1N1, you need to close it again for 10 days. Hindi na po, but what we need to do is to investigate kasi chances are para mag-recur na pabalik-balik ang H1N1 sa isang school, may community transmission talaga within the community where the school is actually located. So pag may community transmission, if you may recall, our recommendation is hindi na po mag-close ng school. Mitigation na po kasi approach natin.
Okay, Dr. Castaneda.
Mr. Chair, I'd like to add that when it comes to tertiary education, it depends, as I said, on the school. Like if you say UP and they see a case in one department, yun lang ang pwedeng magsara. The others have tuloy pa rin yung klase. So it depends on whether, let's say Lasal. Kung Lasal Manila, the natural that they're affected. But Lasal Green Hills is not. And what we're saying is, it depends. We give the option to the head of the school to determine how difficult is a case here or how, the possibility of it spreading around. And the other thing we have to look at, Mr. Chair, also are foreigners who come in the country.
What if it is an office? Ano policy if it's an office? For example, like Congress.
So meron din po tayong guidance para sa
Ano ang
work.
guideline?
We do not recommend closure of say business establishment. Like for example, Congress, yung structure naman yun, sir, like malalayo din naman building. Kung saan po nanggaling ang confirmed case natin ng H1N1, say for example, dito po sa Metro Hall yung case natin at talagang confirmed sa isang section, then we may need to close that area lang po. Or we will be advising yung close contact po nung yung confirmed case natin, compartmentalize po magiging approach po natin.
May natira tayo.
Pwede pa sa session.
Sana may sabi ni Congressman Golez na sana nila natin. Yung sa pwede yung sa pag-propose ng CONAS. So I think we have discussed the matter thoroughly, although we know that this will be holding series of meetings to be updated and briefed by the Department of Health. We are lucky to have with us the representative of WHO, and thank you for that. And the chair would like to inform the Honorable Dominguez, Dr. Dominguez, that this representation is really pushing for the inclusion of Taiwan to WHO. The reason for this is that health has no boundary, and that cases like this, pandemics, SARS, this H1N1, and